Good afternoon. Welcome to day 366 at the EMA office, where we're joined with Chairman Mark Kern. And today we have Sam Bierman from the Health Department. Sam, you escaped from the vaccination site.
I did. I was able to sneak out for a little while.
Oh, I'm
But
sure
we'll be-
they want you back right
I'll be
away.
headed back after we get done here. So as of today, 299,272 St. Clair County residents have been tested, which is an increase of 1,328 from yesterday. We have 28,752 positive test results, which is an increase of 38 from yesterday. And that does include both males and females from under the age of 10 up to their 70s. Today, our daily county positivity rate is 2.9%, and we have 270,520 negative test results. We are announcing no new deaths today, so our number does remain at 462. And for those who have completed the 10-day isolation period, we are at 27,752. For state totals, 19,131,098 have been tested, with 1,209,331 positive test results, which is an increase of 1,484 from yesterday. And for deaths, the state is reporting 20,943, which is an increase of 19 from yesterday. For hospitalization numbers in St. Clair County, currently we have 39 patients that are admitted due to COVID-related reasons, and 3 of them are on ventilators. Regionally, we have 65 patients that are admitted due to COVID-related reasons, and 4 of them are on ventilators. We have no new updates for our congregate living facilities that are in outbreak status, so I will turn it over to Chairman Kern for his update.
Thank you, Sam. Let's go into the zip code report. In 62203, we're up 1 today to 613. 62206 is up 2 to 1287. 62207 up 1 to 583. 62208 up 1 to 1615. 62220 up 2 to 2060. 62221 up 1 to 2762. 62223 up 6 to 1741. 62226 up 3 to 3178. 62232 up 1 to 893. 62239 goes down 1 today to 463. 62254 goes up 1 to 794. 62258, we're up 1 today to 1,036. 62260 up 2 to 795. 62264 up 2 to 357. And 62269 went up 5 to 3,237. 38 new positives in the county today, 1,328 tested, brings our county positivity down today to 2.9%, one of the lowest numbers we've had in a good long time. The 7-day rolling average then is down to 5.3%, and the regional positivity today is also down to 3.2%. And that's derived by the fact that Bond County came in at 0 today. Clinton County is at a negative 0.9%. Madison is at 2.7%. Monroe is at 0% today. Randolph is also at 0%. St. Clair is at 2.8%. And Washington County has a 10% positivity rate today. So, Herb, the numbers appear good right now. I worry that yesterday some people might have been out reveling a little too much on St. Patrick's Day. Hopefully they remembered to wear their masks and wash their hands and follow the recommendations.
The next week and a half to 2 weeks will tell, so we'll be watching that daily. Today is our question and answer day. Brian Whitaker is here with us, and Brian, you have a few questions for the Health Department.
Yes, mostly for the Health Department. Sam, your first question says, I received my first COVID-19 vaccine of Pfizer on February 28th, and I'm due to get my second shot on March 21st. Is there a number I can call if I don't receive the email to schedule my shot? I received my first shot at the fairgrounds. And if it looks like I won't be able to get the second shot through the county, do I go to St. Elizabeth's?
So don't be too concerned just yet. When you are due for your second vaccine, approximately 2 to 3 days before that date, you will receive an email on how to sign up for your second dose. So don't be too concerned yet because you still have a few days until we get to that point. But if we get to that point and you aren't contacted, we do have 2 numbers that you can call that go into our call center, and that is open 7 days a week from 8 a.m. to 6 p.m. And those 2 numbers are 825-4447 and 509-6010.
Okay. The next person says, do you know what days this week are Pfizer and what days are Johnson & Johnson? Thank you, Team St. Clair.
So today we have Johnson & Johnson. Monday and Tuesday are both Pfizer. We are closed on Wednesday. And then Thursday and Friday are Pfizer as well.
Okay. And when they sign up for their appointment, it tells them what they're signing up for, either a Pfizer clinic or a Johnson & Johnson.
Correct. When you pick the date that you would like to attend, it does tell you, as Brian said, which vaccine is being given so you can choose appropriately.
Very important for those second doses. Make sure you select. what you-
Exactly. And while we're on that point, we did have several people come by today, scheduling for today on a Johnson & Johnson day for their second dose of Pfizer. Please do look carefully at that because we don't run both types of vaccine the same day. So if it is a Johnson & Johnson day, we don't have any Pfizer down there to give you. So it's important that you look at the schedule very carefully before you make your appointment.
And just because they're due for their second Pfizer today, it's okay for them to wait till Monday,
Absolutely.
Tuesday, Thursday, or Friday to get that.
That is correct, yes.
Okay. The next person says, according to the Illinois Department of Health site, all populations in Illinois, including individuals who are undocumented, can receive the vaccine. No one will be turned away when it's their time to be vaccinated. My adult children are in from Florida. They have medical conditions. Can they be vaccinated in the county?
So for the policy and procedure that we are following for St. Clair County, you either must live in the state of Illinois or work in St. Clair County.
Okay. The next person says, why is it when I call the health department, they transfer me to another place for an appointment before they even know what I need? I'm not calling for an appointment. Who's in charge there?
So we do have a dedicated call center for COVID, and I am sorry if you have been sent over there before they have had a chance to ask you what you're calling for. My suggestion is to call the health department back and let them know that you are not calling about making an appointment for your vaccine, and hopefully they will be able to route you where you need to go.
The next person says, can anyone fill out the vaccine interest form, or is it only for the groups that are currently eligible?
No, we would encourage everyone to sign up for the vaccine notification form. That way we have your information, and when we move to the tier that you fall into, we are able to pull that information, and that's how we get you the information on how to sign up when it is your time. So yes, we encourage everyone to sign up for the vaccine notification form.
Next person says, why can't people get appointments? You have a major place you claim can handle many people, but people like myself and others haven't received a call. What's going on?
So I apologize that you have not been contacted. My first question would be have you completed the vaccine notification form? And if you have and you still have not received any callbacks, as I said, we do have a call center that is dedicated for COVID scheduling and COVID questions 7 days a week. And if you have called there and still have had no luck, please message the EMA page, and Brian has said that he will get me those names and contact information, and we'll get a hold of you.
But you have to comply with who's being vaccinated.
That is
right
correct.
now.
Yes, we are still into haven't opened up to everyone yet. We still have the tier system that IDPH has put out, and we can't move on until the state tells us that we are allowed to do so.
Okay. The next person says, I registered for my second vaccine dose. My confirmation email and text both say, thank you for registering for the March 19th mass transit Pfizer pickup at Shield Street. But I intend to drive to the fairgrounds myself as I did for shot 1. Is there something I should do?
So when we were speaking earlier about making sure that you pick the correct vaccine for the correct day, included in that is we do have the option for people to click a transit appointment. For those appointments, you do have to go to the Shield Street location, and a Metro bus will bring you over. If you do not want to do that, we ask that you get a hold of us at the call center or at the health department. We can cancel your current appointment and schedule you for the main drive-through.
Okay. The next person says, have any of the variants been identified in our area? Could that be a reason for rising numbers?
We have had no indication and no positive test results for the variant in St. Clair County at this time.
The next person says, I need answers. I had an allergic reaction to a childhood immunization years ago that left me paralyzed for a week. The doctors back then didn't know how to treat me. Luckily, I recovered, but many people of that same year all around the U.S. had reactions, and some were not as lucky as me to get back to my normal self. My own doctor says to get the COVID-19 shot only because there's no record of my reaction. The doctor from then is deceased now, and the hospitals don't have a record due to it being over 10 years, and they had been destroyed. I'm in my 50s and concerned about this with this vaccine. What do I do to be protected? I believe they called it GBS. My reaction occurred within 2 hours of getting the childhood shot. Is the medical staff at the vaccine site or our local hospitals able to treat me to reverse it if this effect would occur?
So first thing I would tell you is, and it sounds like you have done that, is to check with your primary care physician. We always recommend you talking to your doctor to determine if the vaccine is right for you. But the answer is yes, we do have 15 and 30-minute observation lots. 15 minutes is if you have no food allergies, you've never had a reaction to any vaccine in the past. And a 30-minute observation time is for people who might have underlying medical conditions or who have a history of vaccine reactions. So yes, we do have medical staff and we do have ambulances on site should you happen to have a reaction within either the 15-minute lot or the 30-minute lot. So we do have medical staff on hand, and that is why we do ask that you wait the 15 or 30 minutes to make sure that you don't have any reaction.
Okay. The next person says, I was in the hospital with an infection. How long should I wait before getting my first vaccine?
Again, we recommend you checking with your primary care physician to make sure that they decide that the vaccine is right for you. And once you get the go-ahead from them, if you haven't done so, please fill out the vaccine notification form so we have your information to contact you when it is your time.
Okay. The next person says, per our governor and IDPH, health departments are urged to reach out to seniors who haven't signed up to be vaccinated. Madison County is sending out postcards. What process is being used by St. Clair County to reach all seniors? How many seniors 65 years and old on your list have not been vaccinated? Have all long-term care, group homes, and assisted living been fully vaccinated?
So for the first part of that question, yes, we have reached out to many of our seniors in St. Clair County. We've done that several ways. We have reached out to senior centers all across the county, as well as PSOP, which is Programs and Services for Older Persons. So we've reached out to those individuals in the community, as well as any senior housing that we have, to figure out where those individuals are, how many they have, and we have started doing mobile clinics to some of those locations. As far as the long-term care facilities, there was a federal partnership program with Walgreens and CVS that they actually came into the facility to vaccinate the residents and the staff.
On top of all of that, we've been doing this briefing 366 days now. So
Yes.
we're hoping that some of those senior citizens that are out there have family members that are looking out for their loved ones and are helping them get registered. So
Yes.
that's another way we're doing it. also.
And to add on to that point, we did have a very large response to the vaccine notification form for people that weren't the greatest with technology. They had family members or grandkids or neighbors that were able to help sign them up. So we did have their information. So when we were ready for them, we were able to contact them.
And that's why we run the call center with a simple phone number that people can call if they have any kind of difficulty. We encourage people to sign up, and we make this as easy as we possibly can.
The next person says, is there a difference between the Pfizer 2 appointment and the one listed as Pfizer Clinic?
No, that is just the way we had to do it within our scheduling system. So no, there is no difference. It is the same thing.
The next person says, if a person tests positive for COVID-19 and isolates for 2 weeks, will they be retested after the 2 weeks?
So per the guidelines, the isolation time if you are positive is 10 days. And the state recommends a symptom-based model versus a test-based model. And the reason for that is once you are positive for COVID, you can actually test positive for several weeks after. That does not indicate that you are still able to pass along the virus to someone else. So we go by symptom-based, not test-based.
Okay. The next one says, why does the IDPH website show many more deaths for our county than the reports here? Yesterday, EMA Post said there were 462 deaths, but IDPH said 480. Where does the state get its numbers? I assume that the EMA reported number is correct.
So as we have said all along, the numbers that we report here at EMA are the numbers that are reported to us as a health department. It is possible that there have been some that have not been reported to us as a local health department, but have gone up the chain to the state. So we've always been very confident that the numbers that we bring to you are the numbers that we have at St. Clair County Health Department.
The next person said IDPH posted St. Clair County Local Health Department having 30,007 doses in inventory on March 11th. St. Clair County inventory went down to 19,080 doses on March 12th. Does that mean St. Clair County Health Department gave over 10,000 vaccines in one day? Is that data correct? If yes, how many locations do you have in St. Clair County that allows the health department to give 10,000 injections to residents in one day?
So the information on that portion of the website is only updated once a week. So it's possible that we could have depleted that and also received some shipments of vaccine all within that week, making the numbers to look like something that they aren't. But I can tell you as of now, we have vaccinated 89,408 residents of St. Clair County, and partially vaccinated 89,408, fully vaccinated, which means both shots have been received, or the one for Johnson & Johnson, 33,247, which is a little over 12%. So, we aren't there yet, but we are continuing to work hard. The St. Clair County Health Department, of course, has the mass vaccination site down at the fairgrounds. We also have the 330 West Main location, and both of our hospitals in St. Clair County, Memorial and St. Elizabeth's, are also giving doses of the vaccine.
And the East Side Health
And-
District.
correct.
Touche are also, East Side's doing mobile clinics with the National Guard.
That is correct.
5 days a week, and Touche Hospital. So we have a lot of opportunities to give a large number of doses every day here in St. Clair County.
Exactly.
Okay, Sam, thank you very much. We'll go to Chairman Kern for a couple questions that came in. Chairman, the first person asked, is there anything that I can do if I see too many people gathering without masks and not doing social distancing in my neighborhood?
So we share those concerns with you. Hospitalizations are up 11 since Wednesday. So this virus is still in our community. It's still out there. It's still being passed along. And so we really need to encourage people to continue to watch that social distance, wash their hands, and wear their masks. But as Sam said, 89,000 people have gotten their first dose, 33,000 are complete. So those people might be doing this all right. They might have had the vaccine and be able to do this. But what I would say is encourage your neighbors to follow the guidelines, and I would encourage you, certainly, if you see that kind of behavior going on, don't go over, and get yourself infected. Try to work with people, but if those people are not aware by now that this virus is a terrible thing, it's killed 462 people in this county, I'm not sure that any talking is going to get people to follow the guidelines if they aren't doing it by now.
And Chairman, the updated CDC guidance and followed by the IDPH guidance said for those private gatherings, it would be okay in small groups that have been vaccinated not to wear the mask. But if you're out in public like that, large gatherings in a neighborhood, you should still be wearing a mask, exercising social distance.
But yeah, they didn't say how big it was. I figured if it's a neighborhood gathering, it would be people that know each other. That's why you just have to kind of, look at the situation, avoid where you think you might get infected yourself, and realize that we're kind of in a state now where some people are starting to go out, and it may be a little too early. We don't want to see that. We don't want to see this infection grow. So we 100% agree with your concern.
And that goes right into the next question. Says the IDPH renews release says about phase 4 that events should be limited to 50 people. But people don't understand that 50 people should still social distance and wear masks to use these guidelines and not use them as an excuse to have events with multiple families together. Can you reinforce the importance of keeping your distance and wearing masks as we continue, as we do each day?
That 50, the number 50 is still the limitation. People need to follow that, and they need to continue to wear the mask. Watch that 6-foot distance. It's certainly been well proven that distance can give you a certain amount of protection from someone who does have COVID. Because remember, there are a lot of people out there that haven't been vaccinated and still may be asymptomatic carriers, or they might even have a symptom that they think might not be COVID, but it turns out it is. So let's get rid of this virus. Let's just hang on and do all the things that we've been talking about now for a year, so that we don't have to do this anymore, so that by hopefully Memorial Day, we can start to get back to normal lives, maybe even without a lot of the restrictions that we've had.
Okay. Last one for the day is just a comment. It says, I saw people celebrating this weekend with no masks and definitely not social distancing. What a shame that partying was more important than people's health.
Well, and again, we've been saying it now for all of this last year. People have to take responsibility. We came 366 days, and the light at the end of that tunnel is getting brighter. As Sam said earlier, you start by helping be a part of that solution, like so many of Team St. Clair members have, by signing up on the EMA page or on the health department page. To date, we've had up to 114,310 citizens have shown interest in getting the vaccination. That's 630 more since yesterday. So we have been doing everything we can to make it as simple as possible. Everything, as the chairman said, from the call center, assisting those who need help in getting those appointments. And no, it's not been a perfect system, but it's the best system that we've put together. And for those of you who leave your comments and praise what the National Guard and our medical staff are doing, we thank each and every one of you. We're not out of the woods yet. As we say every day, we have to get more people vaccinated. Once the vaccine continues to come in, and like Sam said, we've got appointments that are opening up all the way through next week. So you should be getting notified if you're waiting for your second notice. A couple of days before that due date, you should be getting that notification. If not, call those numbers that she listed, and the call center will help you. Yes, you may have to wait a little bit, but the men and women in the call center are answering hundreds and hundreds of calls a day, trying to meet the needs of each and every one of you. We'll be back with Cindy in a few moments to translate this into the Spanish communities, and then we'll be back tomorrow for day 367. Have a good evening.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we